much room for us to get through, we're going to resist that. If we do the opposite, we vasodilate, have a wide open lumen, and there's not much resistance in there. So we're going to have trouble with that situation as well. Need to be somewhere in the middle. So here's our variables. Flow is going to be a factor of pressure and a factor of resistance. If we don't have any flow, or if we don't have any pressure, we can't have flow. There's nothing pushing water. So we have to have a difference in pressure. And this difference in pressure is the aorta versus getting smaller away. So we're going to have high pressure up in the aorta and lower pressure as we get further away. So there's our pressure, and then we're going to keep having flow. As long as we have a difference in pressure, we're going to have some flow. And then resistance is the other factor, is what's going on in there. If we have a lot of resistance, we're going to have a little bit of flow. If we all try to go rushing out the door right now, the doorway is only so big, right? So there's going to be a lot of resistance, and we're not going to flow out that door very well. If this whole thing was the opening, we would just, no resistance, we would just go right on out, right? So resistance and flow are that inverse relationship. In order to have flow, we have to have pressure. So pressure has to push it, and then we got to look at what is the opening that we're going through. That's the resistance factor. So peripheral resistance, most resistance occurs in the arteries, which have much smooth muscle because we're able to make it small. So more resistance. Does that make sense? Okay. Got to have flow. Got to have pressure to have flow. So here we are. We're starting up with the aorta. We have a lot of pressure in that largest vessel, and then we're getting into smaller arteries, so we don't have as much pressure out there. And then we go into the arterioles. They're small, so we're going to have a little bit of pressure because they can't withstand that much pressure. And then capillaries are really fragile, so the pressure is dropping even more. And then look what happens when we get into veins. Veins don't have that ability to vasoconstrict and dilate. They don't have that muscular wall, so the pressure is dropping. And the lowest pressure in our body is the superior and inferior vena cava. Kind of weird, they're really big, aren't they? But there's no pressure there because they're such large vessels, they're just collapsing in on themselves. So that's the whole dynamic between pressure, flow, and resistance. Is we have to have a difference in pressure so we can push. And then the resistance, the smaller we get, the more resistance we have, the less flow we're going to have. So the artery is the largest vessel in our body. How much flow do we have going through there? A lot of flow, a lot of pressure. The vessels, as we get further away, they get smaller, so there's more resistance, so there's less flow. And then there's less pressure, so there's less flow. And we're going to feel pounding in the arteries. We're not going to feel that in the veins because there's not much pressure out there, so we don't feel that pulsing in veins. We see that out here in the arteries. So that's the whole dynamic that we're looking at, is we're just looking at the physical structure, that there's a wide open area, there's a little resistance, there's going to be a lot of flow. So lots of flow in the aorta. As we get smaller and smaller in the capillaries, it's constricted, so there's a little bit of flow out there. So that's, again, structure determining function. And the smaller we get, we can't withstand that much pressure or we blow out the vessels. So the pressure is going to decrease as we get further away from those big openings. And then veins don't have the ability to hold themselves open, so the pressure is going to be slow out there as well. So highest blood pressure up here in the aorta, that's where we're going to take your blood pressure on your brachial artery. Should be about 120/80. And then it's going to keep dropping. And that's the way it should be. All right, so arteries, low resistance. We have a big opening, not much resistance, good flow. That's how we want it. So we have a large radius. The reason we have that is so that we can transfer stuff. We want to get oxygen out to the organs. We want to get nutrients out to the organs. So depending on where we are in the body, we're going to have those 3 different levels of porousness. In the brain, very tight. We don't want things getting across. In the intestines, we want nutrients to get across. And then in the liver and the kidneys, we want a lot of flow going on. So we have that porous nature in there, how much exchange is going on. And then we have this whole pressure, resistance, flow thing going on. So the vessels are what controls the dynamics of our body. Depending on if it constricts, we're not going to have much flow, but we're going to have a lot of pressure. If we have a lot of pressure, then it's going to be open. If we have a lot of pressure, then it's going to be a small thing, we're going to have a little flow. If it's open, low pressure, but not much flow, because there's no pressure pushing things through. So it's controlling the dynamics of the fluids through our bodies, fluid dynamics. So if you go and sit in on an engineering class, they're learning this exact same thing, but they're talking about, instead of the human body, whatever is flowing through. So if it's, the plumbing, exact same dynamics that we're talking about here. So engineers, when we were sitting in the break room one day, we were all talking, and the guys are doing their HVAC and their electrical stuff, and they were talking about something. I was like, oh yeah, pressure and resistance and flow, and they're like, oh, you're a girl, how do you know this? I'm like, you're a girl. I'm like, well, this is how the human body works. How you guys have a body, how come you don't know this? And they're like, what? I said, yeah, well, we girls know things too. Girls like science too. But they were surprised to see how similar they were. It's like, well, it's the laws of physics. It doesn't matter what we're talking about, it's still the laws of physics. Of course, pressure and flow go together. Resistance is always going to be a part of that. So it's what we call fluid dynamics. Okay, different expressions with pressure. We learned systole, so we're looking at our picture here. Systole is maximum, and that's what our blood pressure, we're going to be reading that number of 120. And diastole is the lowest pressure. So maximum is we have a lot of blood in there, we have a lot of pressure in there, so that should be 120. Diastole, we've just ejected the blood out, so there's going to be less pressure, and that's the low number. So that's our 120 over 80. If we want to know what our pulse pressure is, that's the difference between the two. And then our mean arterial pressure is the average. So when somebody comes in and gets their blood pressure, you want to take their blood pressure an average of 3 times to get a true reading. Because that first one, maybe you go to the doctor in the morning, and you're rushing to get out of the house, and you have some coffee, and there was traffic, and you're just in a hurry. So the blood pressure might be a little higher than what it really is. And then maybe the next time you go in the middle of the day, you're much more relaxed, you got a little bit of time, so your blood pressure might be a little bit lower. And then the next time you go, maybe you go in the morning again and you're all cranked up, or maybe you go in the evening and you're racing all around again. So you want to take an average to get somebody's real reading, and that's called the mean arterial pressure, which is just an average of all your readings. The best case scenario is to have your patient come in about the same time every day. So then you know, okay, well, this is normal for you, versus if you have a morning and afternoon or evening, because blood pressures are going to be different at different times. So like my blood pressure is going to be much higher right now. I don't hear Ruby talking, blah, blah, blah. And yours is going to be lower because you're sitting out there. So you kind of want to get an average and see what is true for that patient. Yes.
And isn't it true that situations or circumstances will affect?
Sure, yeah. If you're in pain, blood pressure is going to go up 10 millimeters automatically. If you're scared, nervous, white coat syndrome, you get in the doctor's office, oh my gosh, I know it's going to be horrible news. Your blood pressure is going to go up. Or oh my gosh, you're going to ask me to get on the scale, and they're going to weigh me again. Your blood pressure is going to go up. So situations definitely jack your blood pressure up for sure. And here's our picture of systole and diastole. Here's our blood vessel going through. We can see the blood pushing out on the vessel walls, and that's our highest pressure. That's up in the aorta. That systole should be about 120. And then we eject the blood out, so it's still in the vessel, but we don't have the maximum pressure. So we still have blood in there, but it's pushing out, or we've ejected it. 120 over 80 is normal systole over diastole. Questions over there? Pulse pressure magnitude between systole and diastole, what we're just talking about, the pulse on those vessels. So we're going to see pulsing in arteries, and we'll see it in your neck because that's one of our, it's coming right off of the aorta, and it's really close to that, so that's where we're going to see the pulsing in there. During diastole, we don't feel the pulse because it's systole, maximum pressure, diastole, contract, relax, contract, relax. So we feel the pulse on the systole, not on the diastole. And what we're feeling is that expansion, when the vessel's full, all the way full, just before it contracts and then relaxes. So systole versus diastole.
That way you have to just push in your eyes.
Yeah, that's aggravating.
Yeah.
Okay, that's it for arteries. Now we're gonna go on to veins. So arteries, nice big openings because they have muscular walls. They can vasoconstrict and vasodilate. We feel pulses in there, and that's where we're gonna do your blood pressure because we're contracting and relaxing, contracting and relaxing. Then we get into veins, and veins are different. They're still carrying blood, but anatomically they're very different. So we're gonna have low blood pressure in veins. And we're going from like 20 down to 0, so we hardly have any pressure in there. They're a reservoir, and they're just going to hold the blood, but they're not necessarily pumping it through like arteries are. So veins don't have that ability to vasoconstrict and vasodilate, so we don't get that contract, relax thing. Veins are dependent on 2 different pumps, one of them being our muscles. So we have to move around, physically be moving, and when the skeletal muscle contracts around the vein, it's going to push the blood up towards the heart. So that's one thing. Veins are dependent on the muscles around it to keep blood flowing up to the heart. The other thing is when we get into the chest, it's going to be dependent on, so we're expanding and contracting, and we're squeezing blood to the heart. So veins are dependent on the things around it to move the blood, and it's that lungs expanding and contracting, or it's the muscles all around us moving that are pushing the blood back towards the heart. The other thing they have is valves. Arteries do not have valves, veins have valves, and the valves close so that when we're moving and we squirt that blood up, the valve closes and the blood doesn't regurgitate back down. So veins have valves to prevent backflow. And then this is what varicose veins are all about, is veins are, we're moving around, we're squeezing the blood up and the valves close. If we're standing for really long periods of time, we're not moving, we're just standing here. So blood is back pulling, and it's pulling, and your extremities get swollen, and then those veins start to bulge out. So we have to be moving around to keep that blood going, and then those valves will close to keep the blood going up. If we just keep standing, we're not moving, so the blood starts pooling and it pushes out on those small vessels. That's varicose veins. Whether it be in your legs, usually we see it behind our knees, or somewhere in our legs, because that's gravity working with us, working against us. Or hemorrhoids are the same thing. Hemorrhoids are a kind of varicose veins, just in a different area. So you're pushing down a lot, and you're pushing into those vessels, and that's what hemorrhoids are all about. So truck drivers get them a lot because they're sitting, there's a lot of downward pressure. Pregnant women get them because there's a lot of downward pressure from the belly pushing down.
Well, this might be gross, but when I worked in labor and delivery, a lot of women have them like on their vagina.
Right.
And I was just wondering why that was. Is
Yeah.
it because their belly kind of sitting there?
Right, exact same thing. So the baby is there pushing down, and so you're pushing, that pressure is pushing down, and then during labor you're pushing, so you're really pushing a lot of blood there. That doesn't normally happen. And it's just, yeah.
Yeah. Don't Google it. Don't.
Don't Google it.
It's really.
So it's a factor of gravity and pressure pushing on those vessels, and they're not made for that kind of thing. They can't withstand that. So it's going to be wherever the pressure is.
What about the spider veins? I mean, they're always-
So, yeah, spider veins are just, it's a little bit of that leaking going on. It's not a lot of pressure, you're still moving around, but you're on your feet a lot. So it's still backflowing, but you have enough movement that they're not bulging out like other varicose veins, but it's the beginning of it.
So it's not rupturing, it's just a slight bulge.
Right, it's more expanded.
Okay.
Right. And not to the point where they're distorted or visible, or, like distended, they're just visible.
If they were to burst, it would look like a bruise then?
Right.
Obviously, okay.
Yeah.
If it was to burst one? If it were to burst, it would look like a
It
bruise.
looks like a bruise, because of the blood gets out of it. So that's the story with veins, is veins are dependent. This is why So if you have a job where you're standing a lot, you need to take breaks and walk around. Some teachers have that because they're standing. We move around a little bit up here, but we're not, like up and down stairs and stuff. You're moving a little bit. Hairdressers get this. Nurses obviously get this because they're on their feet for 12-hour shifts. You're moving around, but you're on your feet so much that blood is always pulling downwards. And then if you're on a flight, we talked about that, as the pressure is different anyways in the plane. Your legs are hanging down, so you want to get up and move around so the blood flow goes, and the pressure is different too, so you want to try to get up and move around as much as you can with that. If you're on a car trip, same ideas. Some people are like, power through. We're going to stop one time for the bathroom. Well, we absolutely have to, and then you get out and you're like, my hips are sore, my legs, they kind of feel heavy. It's that whole blood going down situation. You need to move around and get that blood flowing. That's the story of it. Questions? It's a never-ending day. Factors which can affect blood pressure. So we've described blood pressure, 3 variables, 2 of them in similar familiar equations. So here we are again. Pressure, it's all about the pressure, as we have to keep having pressure in order to have flow. And in vessel, in the veins, we have very low pressure, so we sometimes get into issues of flow with that. And then, of course, resistance is always going to be. So blood pressure is cardiac output, how much blood are we pushing around our body, and over what area, peripheral resistance. So we're moving blood far away from the heart, peripheral resistance. So the flow is through the entire body, cardiac output is going to be part of it, and then the resistance is part of it because we're moving it through our whole body. So same thing, we're just putting different words in here, but we're still looking at flow. What is flow, cardiac output, and where are we putting that output through our whole body? So blood pressure is going to be affected by those 2 things. Is we got to put the flow out there, and what is the resistance that we're going to encounter, and those are things that are going to affect blood. As far as cardiac output and resistance, blood volume affects blood pressure. Well, that makes perfect sense, doesn't it? What happens if we start bleeding out when we hemorrhage? What happens to our blood pressure? It's going to plummet, isn't it? So we are losing volumes. There's nothing there to push, so we don't have blood pressure. So that makes sense. That's an easy one. We already know this. Resistance is a function of diameter. The larger the diameter, the less the resistance. So if we have the aorta, nice big opening, there's not much resistance, we're going to have a lot of flow there. So that's our direct relationship between resistance and blood pressure. The less resistance, the greater the flow. The more resistance, the less the flow, the less the blood pressure. So resistance and blood pressure are directly related. If we have a whole lot of resistance, or vasoconstricted, what's going to happen to our blood pressure? It's going to go up with it. If we close off that vessel, it's a direct relationship, a lot of resistance, high blood pressure. It's going to go up because we're so constricted that it's forcing that pressure up. If we're doing the opposite, if resistance is little, then our blood pressure is going to go down. We're so vasodilated that the blood pressure is going to go down. So that's a direct relationship. So just picture in your head what's going on with that vessel. If it's constricted, we know it's going to be a little bit of flow, really pushing through there. So pressure is going to be high, so that's the direct relationship, and then the flow is going to be the opposite. If it's constricted, there's not much flow going through there. If it's constricted, it's working hard, there's a lot of pressure. So the direct and indirect relationships there. What we were just talking about. So cardiac output is directly related to blood pressure. If cardiac output increases, we know blood pressure is going to increase. So we're exercising, we're moving around, that's going to make our blood pressure go up, we're going to get hot and sweaty, right? If cardiac output goes down, we're nice and relaxed and we're about ready to take a nap, our blood pressure is going to go down. So they're going to be directly related. And we know cardiac output is heart rate times stroke volume. So blood pressure is going to be a factor. We're going to have cardiac output in there But when we talk about blood pressure, we also have to consider the resistance factor. So cardiac output, we're just putting volumes through. That's all we're concerned about. How much volume are we putting through in a certain amount of time? The heart's beating every time per minute, and we're pushing this much volume through. Down here is cardiac output, but what is going on with the diameter of the vessel? Is it vasoconstricted or is it vasodilated? If it's vasodilated, we're going to have low blood pressure. We're moving blood through the system, and what are we doing with it? Well, let's look at the diameter. We always have to look at the diameter when blood pressure is involved. So we're moving blood, cardiac output, and the vessel is wide open. What's going to happen to pressure? It's going to be down because there's no resistance. If we're vasoconstricted, there's a whole lot of resistance. We're moving blood through a lot of resistance. It's forcing the pressure way up. So depending on what's going on there, that's what we're talking about. So cardiac output is always going to be a factor, but what is going on with the shape of the vessel is what we're talking about here. And that's where blood pressure comes in. So if heart rate goes up, we know blood pressure goes up. If heart rate goes down, blood pressure goes down. Stroke volume goes up, we're pushing more volumes through, our pressure is going to go up or down. Or if it goes down, we're going to put pressure down.
Is that why they say you sleep, typically in normal settings, you sleep better when you're older?
Right,
You're-
because everything
You're
is
slowing down.
slowing down. Yeah, we'll sleep much better. And what happens when we're hot? Are we vasoconstricted or dilated? Vasodilated, because we're trying to get rid of heat, so we're just uncomfortable, right? And our flow is down, our pressure is down, and we're like tossing and turning. And if it's nice and cool out, you're like, ah, it's a perfect night for sleeping. We say that, right? Perfect night for sleeping. Much more comfortable. All right, so that's what we've been talking about. Last slide here, 3 variables. Cardiac output is always the factor. We're always pushing volumes through. We have to look at our resistance. What is the shape of the vessel? And that's going to have an effect on our blood pressure and how much volume are we pushing through. So all of these things are directly related. The only thing that's inversely related is our end-systolic volume. So if cardiac output goes up, heart rate goes up, resistance goes up, all of these things are directly related. And then we'll stop there for today. We're halfway through. Thank you all. I know, I'm with you. So today is Wednesday. Monday we'll continue, we'll finish up this chapter. And
You said 9 a.m. for...
we have our test. If you have meet for lab on Wednesday, our test is at 9 o'clock. Monday is normal class day.
Is it by you open this semester? Like if we were to show up at like a
It is, but not early. Oh yeah, call them or check their